thank you everybody for joining me today. I'm very excited to be presenting here at Wellspring virtually. And I'm just, obviously today's talk is about lymphedema. And please, if you have questions and everything, we're gonna put those in the chat box, or Kristen is gonna open that up at the end. So jot them down or whatever you need to do, and I'm happy to answer. I'll leave some time at the end. I'm gonna be very aware of the time. So for those of you that don't know me, my name is Jody Steele, and I'm a physiotherapist. And my journey started a long time ago in 1997 when I was in kinesiology, and my mother got diagnosed with cancer, and she was not doing, she had lymphoma, and she also had lymphedema of her arm. And the entire time that she was in hospital and stuff, I always thought there's got to be more that she can be doing, but there really, there wasn't a lot out there. Anyway, unfortunately, she died just before I got into physio school, but I swore I was going to avenge her death by being the best oncology physiotherapist I could be. And that really got me thinking about, what can be done for anyone who has lymphedema or has cancer. So back in 2005, I started Cancer Rehab The Next Step, which was the first cancer rehab in all of Canada. So I was very proud of that. And it was a not-for-profit, and we had any individual with cancer and those also with lymphedema. And then I was very lucky to meet Wellspring, or Wellspring came to me in 2009 and said, "We like what you're doing. Can you come with us and join us?" And I was thrilled to do that. So in 2009, we started my cancer exercise program and some lymphedema management, and we're now in the 7 centers across Canada. So that was very exciting. And meanwhile, as a physiotherapist, I did work in the Juravinski Cancer Center and Hospital. I also did home care, private home care, and also with what was CCAC back then, home care specifically for people with lymphedema. So I think I have a lot of experience that I'd like to draw on today. So please feel free to ask me any questions that you have, and I'll try to get those answered. So the first thing I think we need to say is, what is lymphedema? And it is a little bit confusing for people, because when people have a swollen arm or a swollen leg, some clients are always like, why don't they just stick a needle in it and suck it all out? Well, unfortunately, lymphedema doesn't work that way, because it's actually the fluid is accumulated inside the lymphatic system. So it's trapped in there with alongside your circulatory system. And it can't really be just removed, because it's partially water, but it's also protein. And so the only way to get that fluid out is to have it come back through your system and either be urinated out or taken back up in the circulatory system. So it's a very complex, and I'm going to draw a little bit of anatomy, but we'll try not to bore you with that. And unfortunately, lymphedema is a major problem for a lot of our patients, and those of you that have it. It's not just that you have a big swollen arm or a swollen leg or a swollen breast. It's that it actually is painful, it's uncomfortable, it's hard for people to move around and wear clothes. And the one thing that I am going to say for sure is that it does increase the risk of cellulitis, which is a kind of an infection in that area. And we're going to talk about that in a second. So it's very important that you be aware of lymphedema, as well as manage it when, if you do end up getting it. So, and it is quite significant. You can see from this slide that we know that lymphedema, at one point, doctors were not aware so much that, they thought it only happened maybe in 4% of the population of people with cancer. But we now have much better statistics, and we know that anytime someone has lymph nodes removed, there is a possibility and a risk. We also know that if the lymph nodes have been damaged during radiation or any other kind of treatment, that can also increase people's chances of having lymphedema. Okay, and so we want to know that we do recognize, in fact, we know that there's 1 million people in Canada that have lymphedema, and 368,000 in Ontario. So it's very significant. But unfortunately, we're a little bit behind in Canada. Not Wellspring, though. Wellspring's on it. But Canada's a little bit behind in the treatment. There certainly is not readily available a treatment. It's pay per service for specialized therapists. So that's why we're trying to reach out and get people more educated and help people to self-manage. So that's the big part of today's presentation. So the really important reason why we have a lymphatic system is because it actually removes impurities in your system, fights bacteria and viruses. And this is, I guess you can remember, like whenever you have a cold or the flu and you're like, oh, my glands are swollen. People remember doing that. Oh, my glands are swollen. Those aren't really your glands per se. Those are your lymph nodes. So your lymph nodes fire up and get ready when anything foreign comes in your body, and they're going to go out there and try to treat that infection. And then when your infection or your cold or the virus goes away, then the lymphatic system calms back down and you maintain that fluid balance. So very important system to have, but it can get activated very easily. And we also know that we have lots of lymph nodes. So we have about 700 of them throughout your body. And for those that are interested and have breast cancer or have had lymph nodes removed in your axilla or your armpit. Oh, I'm going to show you guys my armpit. Okay, in your armpit, you have about 30 to 50 nodes. So those of you who have had surgery for breast cancer may know that your physician or your surgeon removed 22 nodes or maybe 2 nodes. So some people get that on their OR report, and that's important to know. And I'm going to tell you in just a few more slides why that's important to know how many nodes you've had removed. Okay, so the other thing about the lymphatic system is it's very interesting. It's unlike your circulatory system. So your circulatory system goes around and around and around. The arteries take the blood away from the heart and the veins bring the blood to the heart. The lymphatic system is a one-way system. So it starts at the tips of your fingers or the tips of your toes or the periphery, and it moves along the little vessels, and then comes a bunch of nodes. Then it moves along the vessels, and then there's a bunch of nodes. Moves along the vessels. So it almost looks like a string of pearls. And as you can envision that, and then it ends up dumping right in what's called the mesenteric portal, which is actually just below your ribs, and it's kind of a area there where you're not near your stomach, kind of right in the middle, and it dumps into the mesenteric portal, and then it's either reabsorbed into your circulatory system or all the impurities and the bad stuff are urinated out. The interesting thing about lymphedema too is that it's very superficial. So all your lymphatic vessels are right on the top of your skin. In fact, if you take your finger and you push and you go through your skin till you feel the muscle, you have crushed the lymphatic system. You've crushed the initial vessels and the collecting vessels. So really, we don't need much more than 60 milligrams of mercury. That's how much your push would be. And that's very important if you are considering buying a garment, like an arm sleeve, or if someone's going to bandage you, or if you're going to have a massage. These all have to be very light and superficial, because it won't work if we crush down and push on that system too much. So that's always a hard thing for people to kind of think about, because you think that the fluid is trapped in the entire arm, but it's actually very superficial. And the more interesting point too is that these little vessels, they have little sort of valves on them. So it helps to move the fluid along, and then the valve behind closes. Moves the fluid along, valve behind closes. But when we get lymphedema and the arm gets really big, or the leg, sometimes those little valves don't work anymore, and the system gets even more sort of baggy and saggy. And so that's why we recommend, and I'm going to tell you all the treatments in just a bit, but that's why we recommend garments, bandages, exercise, and sleeves, because that helps to kind of put some pressure on there, not too much, but a little bit of pressure to help move that system along. Oh, there's my little picture. I gotta get a better picture. So you can just see this is the lymphatic system located in green, and you can see how it's a one-way system, and the little green dots are where lots of the nodes are located. And so again, you can see there's lots in the axilla near the breast, lots in the groin. So if we have anybody out there listening that's had any kind of abdominal surgery, cervical cancer, they often take nodes with that, colon cancer, that would be, the nodes would be removed out of the lower extremity, which could cause lower leg edema. There's also quite a few lymph nodes in the neck, if you see the picture there. Oh, I have a little pointer, see there? And so this would also could cause facial edema for anyone who had neck cancer, because often radiation is done at the neck and the nodes are removed. Okay, so here's a picture of one of my clients. And it's important to understand, if you go onto the internet and you Google lymphedema, some of the things that come up can be terrifying, because there is two kinds of lymphedema. Primary lymphedema is when you're born with something wrong with your lymphatic system. And often if you see pictures of those lymphedemas, they're quite extraordinary and very scary. What most people at Wellspring have, if they have that, or most of our people that we're talking with cancer, have secondary lymphedema. So this is due to the nodes being removed because of cancer, surgery for cancer. And so this is called secondary lymphedema, and would only result in the area where the nodes were removed. So in this case, this lady's had breast cancer, and her arm that's sort of higher there she had her breast removed and some lymph nodes taken out, and she has mild to moderate lymphedema in that arm. So just be careful if you go on the internet, because you can get really scared. There's also a form of lymphedema that is mostly in Africa and Asia, and it's caused by mosquito or bug bites, and it is extraordinary too. So don't be nervous if you see those things. Your lymphedema hopefully should never be that extraordinary. Okay. So this is an important slide about the staging of lymphedema, and it used to be back before, we've just added this stage, but back in 2006, we only had 3 stages, 1, 2, and 3. But we now have added stage 0, which really I find is very important. So those are people who are out there that potentially have the risk factors, and I'm going to talk about all those in a second. And if we can stop the lymphedema in its tracks and know that we're potentially at risk, if we can do all the good things to reduce our chance of getting it, that stage is super important, because it's way easier to prevent than to fix once we've gotten it, okay? Stage 1 lymphedema, and this is, so if anyone is out there that has this, it's called spontaneous reversible. So your arm may swell a little bit during the day, but when you elevate it or go to bed, the gravity assists and the lymphedema is gone. So it comes and goes. Again, it's great to get lots of information about it and talk to a physiotherapist or massage therapist about it, but you may not have to start all of the treatment. Whereas stage 2 is spontaneous irreversible, and that means the fluid stays no matter if we use gravity to assist or when we go to bed, it's still swollen, and that doesn't go away on its own. So you need to have some kind of intervention. And the last stage is elephantitis, and we're working very hard to make sure no one gets into this stage, but it is actually that the lymphedema has gone on for long enough that the skin actually changes. And it's called elephantitis because the skin often goes like a gray color. It's very hard. It could have outcroppings or pustular, things like that. More often, again, seen in congenital or stage 1 lymphedema, and more often seen in the lower extremity. Okay, so we're going to talk first just a little bit about what is not lymphedema. So, and these are mostly confusion with the lower extremity. So congestive heart failure is not lymphedema. This is when you have bilateral, so both legs are involved and they're swollen, and it has to do with your water intake. Your physician would give you some diuretics and that would go away, and they would monitor your heart. Lymphedema due to cancer is usually just one-sided, not always, but usually just one-sided, okay? It is not lymphedema if your legs look like this. This is chronic venous insufficiency. This is what lymphedema, stage 3 elephantitis looks like. So you can see the changes in the skin, how it's very purpley gray, and there's some definitely raised areas. Again, this is not lymphedema, so you would go to the doctor and they would say you had chronic venous insufficiency, and that would be a different treatment than lymphedema, okay? And the last one here, this is lipidemia, quite rare, but we do see it sometimes. And this is when the legs are very big, but the feet are quite tiny and the upper body is quite tiny. And people mistake it for lymphedema, and it's a fatty deposit. So if you treat someone with lipedema, the way that we treat lymphedema, it doesn't work. So again, the physician, your doctor, oncologist would know if you had a pre-existing case of lipedema. Okay. So here's probably the most important slide. So if you have this slide deck printed out, or if you have the workbook that I sent along, this is probably the most important slide there is. And it is called the risk factors for lymphedema. So if you have had a surgical intervention for any kind of cancer, that would put you at a higher risk of lymphedema. We don't have statistics for the lower extremity, we just have them for the upper extremity, but we know people who have had 6 or less nodes removed out of the armpit have a minimal risk. People between 6 and 9, first under 6 is minimal risk, between 6 and 9 is a moderate risk, and anything greater than 9 nodes removed would be a greater risk of lymphedema. So that's the surgical part of it. So that's one piece. So if you've had 22 nodes, that would be one piece that you're at more of a risk. But the amount of nodes taken out isn't the only thing that matters. It's also if you've had radiation in that particular area, if you had a significant infection after your surgery, that would increase your risk. Because remember I said a little bit earlier that your lymphatic system is the one that is working on getting rid of foreign bodies and infections. If there's obesity, I don't think I have to go through all of these, but you can see them on the list. Those are the ones that put you more at risk. But the one that I really want to highlight that everybody can practice starting today is what we call trauma to the arm. So if you've had lymph nodes resected and some radiation and cancer treatment, you want to make sure that you don't expose that arm to, bug bites, blood pressure, needles, trauma. I'll tell you a few stories. So I had a client and she was doing so great and she had some risk factors, and then she went and had a party and decided to use a juicer, and she juiced 13 limes to make limeade or something. And that was too much for her arm. And the next day she started to show signs of lymphedema. I had another client who was not doing much all winter, and then she went out in the spring and then dug out a stump, and that was too much for the arm. And so we're not going to, I don't want to scare you and you have to put your arm in a bubble and never use it, but you just have to be aware that if you haven't done something for a while and then you're really asking a lot of that arm, it could stimulate some overuse of the lymphatic system. So again, another story I have to tell too is I had, all my clients were coming in for cancer treatment, and unfortunately there was a bee's nest at the bottom of my clinic where they were coming in, and one of the gentlemen who had breast cancer had got stung in the arm by a bee, and that sort of set off his lymphedema. So you want to be careful with bug bites. You want to be careful if you're getting chemotherapy, you need to ask the nurses to use the other arm, because again, any kind of needle prick or anything like that. Even blood pressure, we don't recommend blood pressure being done on that arm, again, because you're restricting the lymphatic vessels. And a blood pressure cuff usually rises to over 200 milligrams of mercury. And so that would really crush the system, because before I had said that the system is really crushed at 60 milligrams of mercury. So we want to just be really careful with your arm and be aware that you just don't put yourself at risk. And the thing that's kind of hard for some of our clients to remember is that it's forever. Your lymph nodes do not grow back. So this is a chronic condition that you have, or if you don't have it, if you've got risk factors, they're forever. So even 20 years after your breast surgery or your groin surgery, you still have to be cognizant of all of these things, because lymphedema can rear its head anytime. Okay? I'm sure there are going to be questions about that one, so mark that one on your page of paper. Okay, but how do we reduce the chances of getting lymphedema when you're aware of the risks. And the great thing is that if you take good care of your skin and nails, if you avoid that trauma to that area, if you use bug repellent and sunscreen, and you exercise, that's going to be my big exercise is my big shtick, so I'm going to be saying that a million times. But we know that people that exercise, so pumping the muscles in that area, we know that they have a reduced chance of getting lymphedema. Okay, so we tell people just be really careful and be aware of these things, and that will help you to make sure that you don't get lymphedema, or if you have early lymphedema, that it won't get worse. And I've had many, many clients over my career saying, if I only knew, if I'd only known that, when I had a hangnail, if I had known to take better care of it, I wouldn't have got lymphedema, if I'd only known. So now you know, so pass the word on, and just remember to protect that arm from those things. And again, if you're concerned, to make sure you contact a physiotherapist or someone who is specialized in lymphedema. Okay, so what do you, if you suspect you have lymphedema, or you just want more information, you should make sure you go to a specialist, and you'll get a medical assessment and a physical assessment and some other ones. So I'm just going to show a quick few things. Things if you're that you can be aware of is if you feel a heaviness in the arm, if your rings don't fit, some people say, oh, I used to be able to see the veins in the back of my hand, but now I can't. My shirt is a little tighter on that side. I even have some clients that said that they said they feel like they have little bugs crawling or water dripping down their chest, but there's nothing there when they look. So those are all kinds of things that you can say, okay, I'm having these symptoms, I probably need to see somebody. Of course, if you notice that it's, you can actually see the fluid underneath the skin, that would probably be a good sign. And the one that you want to be really careful of is if the arm or leg is hot, if it's painful, that could be signs of infection. So that could be lymphedema with some cellulitis on top. So that one would be one that you don't want to. Oh, there goes my husband. Anyway, if you feel like because lymphedema is normally swollen, cold, shiny, and can be painful depending on where the tightness is. But if you had an infection on top of your lymphedema, it would be hot, swollen, red, and very painful. And if that was the case, you need to contact you need to go to emergency right away, because when you have cellulitis, you need to get that treated either by oral antibiotics or sometimes by IV. Okay? So also the other thing, when you meet, if you're concerned, or you come to Wellspring and see us when we can, or if you see a specialist in lymphedema, they will take measurements of your arm or your leg. And we do this just with using a measuring tape, and we go circumferentially around the limb. And these are the spots that we go on. So if it was the arm, it would be around your hand, then around your wrist, then just below the elbow, and just above the elbow. And the reason it's really important to get to somebody to get these measurements, even if you don't have lymphedema, but you have some risk factors, then we have a baseline. So you will know if you start to feel some symptoms or something, then you can come back to me or to Wellspring or to your therapist, and you can measure that again. We know from the research that if there's a change in 2 centimeters in any of the circumferential measurements, that would warrant the start or the beginning of treatment for lymphedema. And again, if we go back to thinking about risk factors, if we have early diagnosis, if we get to you right away, it's really easy, much easier to control and to get that fluid out right away. So it's a great idea that to get measured by anyone who is able to do that for you. Okay, and other things that we like to measure as well when you come to see a therapist with your lymphedema is we like to look at this is just an assessment from home care if you are treated in home care. And what they're looking at is, are you able to functionally do the things that you used to? So the big one for the hand and the upper extremity is, Are you having trouble with buttons? Can you put it on and off your garments? Are you able to wash the dishes and vacuum? Well, not that you want to do that. Nobody wants to wash dishes, but are those things, are you able to do those things, or does your lymphedema not allow you because perhaps it's so swollen you don't have good range of motion in your hands? And just to speak of the lower extremity, you know, are you able to get up? Are you able to walk? Can you, you know, take your footwear off? Some of my clients in the community, the lymphedema is so big that they can't wear shoes. So that makes them, you know, socially isolates them because they can't get shoes to get out in the community. So we look to see what things might need to be treated, and we can use these at a baseline, and then we can massage and bandage and exercise you, and then hopefully improve these functional abilities. The other thing we look at is called the lymphatic cording, also could be called webbing syndrome, if you've heard of that. And what that is because the lymph nodes are this, remember, the string of pearls. When you disrupt that string of pearls, so you take some nodes out of the armpit, it pulls the whole system really tight. I try to tell my clients it's kind of like a spider web. And then if you put like a ping pong ball on the spider web, you know how it goes really, really taut and it looks like it's going to snap. Well, the same thing is with the lymphatic system. So this lady, you can probably see, she's a very good friend of mine, and she had the nodes removed in her axilla. And then when she puts her arm in this position, it's almost like a guitar string or like a really tight cord that you can almost strum in your elbow, in your armpit. And that's called the lymphatic webbing syndrome. And if you have that, or noticing that, we really need to make sure that we get rid of that cording. One, because you'll be much more comfortable and be able to move your arm, but we also know that that tightness of the system can cause lymphedema. So we need to make sure you come and see someone. And the great thing about it is it's really easy to get rid of. We do a couple stretches and it goes boing, and it kind of snaps off and you're cord free. When I first started at Wellspring, I had a lady who said she couldn't extend her arm for a year because the cord was so tight. All of the physiotherapists there took a turn stretching her, and in 2 weeks, the cord released and she had the use of her arm back. So if you're concerned, and if you're, no one can see you, so if you want to do this, go ahead. But if you're sitting at home, what you're going to do is, can everyone see me? I'll do this. You're going to depress your shoulders, raise your arm, rotate it back, oops, and then straighten it out. That's called depression, abduction, rotation, extension. And if you do that and a cord pops out or you feel extreme tightness, you may have a lymphatic cord. It's also very similar to like putting on a jacket or like getting your seatbelt from the car. So if you notice you have trouble with either of those, either pain or that actual feeling of that cord, then you possibly need to go see somebody to get that manually removed. We don't surgically remove it. We just use stretches and myofascial release and things to have it go away. Okay. The next thing, I got to get moving here. Woo, I got to talk faster. Okay, the next thing we look at too is the scar. So I've had quite a few clients, and you can see this lady here has had a full mastectomy, and she has lymphedema of her arm. But what you may not be able to see is that her scar from her mastectomy is very adhered down to her chest wall, and that's actually trapping the lymphatic fluid. All we did for this lady was do scar massage, release that scar, and the lymphatic fluid just flowed right out of the arm. So again, you need someone to take a look at your scar, or if you, and this goes the same for if your scar is in your groin. If the scar is very thick and immobile, it could be trapping lymphedema, and that could just be the one thing that you need to do is get the scar mobilized. And then lastly, we ask our clients, do you know the signs and symptoms of cellulitis? Do you know the importance of exercise? And then of course your self-care strategies. So let's talk for a second about what the treatment for lymphedema is. So the very first treatment is skincare. Take the time to look at your arm or your leg, look if, in the cracks and the crevices, and make sure that you keep your arm clean using mild soap. And if you like lotions and potions, just make sure they're organic and they don't cause any breakout. Everybody knows that, especially in summertime and you're out in the garden, and lots of times we can pick up little bugs and bacteria. So just to remember to take a good look at your skin and to wash it daily. And that, for one, skincare can be a huge part of decreasing your chance of getting lymphedema. But most importantly, decreasing your chance of getting cellulitis. Because if you remember, oh,
Can you show them the move one more time, the rotation one more time, please?
Oh, I sure can. Can you see me? Oh my gosh, here we go. So if you're doing it at home, it's depression. It spells DARE, D-A-R-E, depression, abduction, rotation, so I'm rotating back, extension. That good? I need a bigger screen or a shorter arm. I'm happy to go through, and that is also in your workbook too, okay? If you got a copy of the workbook. Okay, so again, just cellulitis is very important, so we want to make sure that you recognize the signs of cellulite. Okay, skincare again. This is just a leg. So this gentleman had a melanoma removed off the side of his thigh and then a lymph node resection in his groin. He's a good pal of mine, and he offered up pictures of his leg. And he had terrible lymphedema to the point before he contacted me that he couldn't even bend the leg. And so this is after a little bit of bandaging and massage and exercise. It's quite reduced, and he's able to ambulate and sit at his desk and do his work. But one problem that he had a lot is he couldn't really look at his toes. And so he had cellulitis often from not having good nail care. So again, take a good look at your nails. Make sure that you have somebody trustworthy that's not going to cut. Because if you cut any of the skin around there, that could be trauma to the arm or the leg. Okay, the next thing we can do as a treatment this is the old wellspring in Oakville before it got redone. Anyway, that's me. I think I'm pregnant there. Anyway, and the one thing that we can do is lymphatic massage. Now, I know that everybody knows to contact a lymphatic therapist. You are looking between $80 and $100 per treatment. They are wonderful, and they will see you several times a week. If they're physio or massage, that could be paid for your insurance or out of pocket. And it is a great thing to do. The other thing that you could do is you can do self-massage. So self-massage would be every day you're going to massage your own arm or leg. And again, today's just a quick little demonstration of that. Of course, if you wanted more information, I'd be happy to send videos or do another Zoom. But the idea is that you're going to, a couple things. You want to make sure that you always start at the top and then move down the arm. When you go for a massage, normal massage for your muscle tissue, usually the massage therapist starts at the hand and really digs in there. Lymphatic massage starts at the other end. And the analogy I use in this is that if we pushed all the fluid from the fingertips up all the way, we'd have a big, huge neck, and all the fluid would sit there. The lymphatic system is very slow, so we kind of have to clear it, and move down and clear, and then move down. So the analogy I use is that, you know, if it's at the border and everybody's waiting to get across the border and you just started pushing all the cars from the back, it would just be a big pileup. But you have to let the cars go through first and foremost at the front. So how we do lymphatic massage is we start with some diaphragmatic breaths in through your nose and out through your mouth. We usually lay on our back with the arm or leg elevated so that gravity would assist. Oh, now I got some kind of package coming to the door. Oh well. Yeah. Anyway, then we would start on the unaffected lymph nodes. So we would just, if this was my arm that had lymphedema, I'm just going to do some movements to kind of clear the fluid in my chest. And then also lower down and clear my fluid down here. And then again, we would start at the top. This is called the proximal area, and we would massage up. And I talk a lot, so I don't count. But if you were going to count, they sometimes say 15 strokes, very slow, and then you move down to the next section. 15 strokes, 15 strokes. And the one thing we know is the pressure. So you're not digging in. And I've taken a million lymphedema courses, and the funniest analogies they said are the weight of your hand and then some, or how you would pet a kitten's paw, or this is my favorite one, the weight of 11 envelopes, because we don't know what that is, but anyway, 11 envelopes. So it's very, very light. If you're massaging and you're leaving red marks, then it's probably too much. The other thing I say to the clients, if you do a self-massage for a couple days and it's not working, you're probably going too fast and you're pushing too hard. So it's the exact opposite of what you would expect in a massage, because when you go for a massage, you're like, dig in there and get me good. But not with lymphedema. With lymphedema, you go nice and slow and you go with very light pressure. Okay, so that's the massage. So again, if you're interested, there is a self-massage section in the workbook you could try to work through. I am also available to help anybody. You can contact Kristen and she can send an email out to me and I can do that. Or maybe we can all come together again for a Zoom and just practice self-massaging. There, make more work for Kristen. Anyway, the next section is bandaging. And it's very interesting. The bandages are, there's lots of studies about bandaging, and we are recommending to clients to have either the bandaging or some kind of compressive garment on the arm or the leg so that it helps to support that system. And the idea behind the bandages or is to reduce the volume and to help eliminate any of the skin changes if there starts to be some really tight areas of skin. The bandages and the garment will help to mobilize the skin and just to get things back to a reasonable shape. Here's two different systems that we use. One are called Comproland short stretch bandages, and the other one are 3M Coban. The first ones are washable, and you keep your sets and you wash them and wear them each day. The Coban is usually applied by a nurse and is left on for 3 or 4 days, then cut off, thrown away, and a new set is put on. The bandages, here's my arm. It is an extensive, it needs to be taught. So if this is something that you need to learn, you would have to visit somebody or come to Wellspring and we would teach you. And it's really used for reducing the limb and getting it back to the really small sizes you can. Oh, sorry, Kristen?
Is bandaging only for people who actually have lymphedema and not for prevention? And
yes.
Can you talk about air travel as well?
Yes, and actually that just is perfect because it goes with each other. I'm going to just get to that in a few slides. So yes, bandaging is for people who have lymphedema who want to get as small as they can before they go into a garment. And I'll talk about garments in just a sec. So there's some bandaging of the leg or of the arm, or this is a leg, sorry. And after your bandages, and people say, how long will I be in the bandages? Well, 10 years ago, I used to make everyone wear the bandages for 6 weeks, 23 out of 24 hours a day. But we know now that everybody changes differently. And we know now that people wear the bandages an hour a day during exercise and at night. And some people can reduce the size of their limb within 2 weeks. Some with more extensive lymphedema may need their bandages for 2 months, but there's no cookie cutter really prescription. But what we do know is that you want to wear the bandages until your limb reduces, and then you're going to go into a garment. A garment can also be used prophylactically. So whoever just asked that great question, there are some studies that show a light fitting garment could help to reduce your chance of lymphedema. So again, these are some studies that I'm going to show you in the next couple of slides what garments would be suitable, okay? So then the garment, let me show you a picture. Here's a picture of someone with lymphedemas, and these are a lovely, very light product, and they come in fancy colors, and you can get those really over the counter. We have a great place here in St. Catharines at the St. Catharines Hospital, Hauser's Pharmacy. There's a wonderful lymphedema person in there, and you can buy these for about $100, and they are just ready-made, and they go on like small, medium, large. That would be for no lymphedema if you're using it prophylactically, or if you had mild lymphedema, okay? And again, it's very helpful. And I tell some of my clients, put it away in the cupboard. You don't need it unless you're gonna go and play football with your grandkids, or put it away till you're gonna travel, air travel. And I think I'll speak to air travel right now if you'd like. The jury's kind of out. They used to think that air travel, you got lymphedema. We saw lots of cases of lymphedema when people traveled on an airplane, and they thought it had something to do with pressure. They now realize through studies that it is actually because of more of what happens to you through a day of travel. So, you're kind of stressed out, you don't drink enough water, there's long periods of immobility. things like that. And those are the more likely reasons that you would get lymphedema. So we've noticed that people that go on short trips, you know, maybe just from here to Florida, are less likely because they don't have those things. And we know that people that wear a prophylactic sleeve, like the one that you see on, do some exercises on the plane and stay fully hydrated, have less chances of getting edema. So it's kind of, I recommend for my clients to wear some kind of compression no matter when they travel. But I also have clients, I have a client, a young girl that is a airline stewardess, and that's what she does. She flies like every day, and she has significant node reduction, and she had a mastectomy, and she's, knock on wood, has never got lymphedema, but she wears her sleeve every flight. Hopefully that answered your client question. Okay, I gotta keep moving here. Okay, anyway, so here's the garment. Some reasons why you wouldn't wear it, but of course you would contact a lymphatic therapist and they would let you know if you had any of those. And I'm just going to scoot along here, but this is just to shows the compression. So if you're purchasing, again, someone would help you with this, but if you were looking to get a sleeve, just you don't have lymphedema, you would look for a compression of 15 to 20 milligrams of mercury, really low. Whereas someone who had quite significant lymphedema could have 40 milligrams of pressure at the hand and 20 up here. But someone would help you with that. And there's also, you need to know if you're having circular knit or flat knit. So flat knit is more the ones that you see that are that beige color, and those are custom made. And they run anywhere from $300 to $2,000, but the government does assist in the payment of that, and the government will pay for 75% of that. Okay, oh, and here's my little, this is one of my oldest ladies that ever came to Wellspring. She was 94 and she had quite significant lymphedema, but look at, she got a cute little sleeve that matched her shirt, and with exercise and a little bit of bandage or a little sleeve and massage, she was all better. So I just want to highlight how important exercise is. So even if nothing else from this presentation, you can go home or you're at home, you can start to move that limb a little bit, it will help. And this is just a study that shows that they did, people who did a bit of gentle weightlifting and exercise while wearing a garment had significant reduction in chances of getting lymphedema. And those who had lymphedema, it did not get worse. In fact, they often got better, and they had less cases of cellulitis. So here's just some exercises. And again, these are in your book. But again, when you want to pump the muscles of the area that has lymphedema. So if you have lymphedema in your arm, it's great to go for a walk, but you really need to do exercises with those muscles. So you go for your walk, which is great, but you also want to pump your flexor and extensor muscles, your biceps, your triceps, and of course, all your fingers. And again, if you had leg lymphedema, you would wear your garment or your bandages and you would pump the muscles underneath those bandages. Okay, so this is some calf raises and some ball squeeze and some quadriceps. And these are all in the book as well. If you forget, you can always look those up. So, and lastly, I'm just going to highlight, I guess I am coming to the end, I almost finished up. If you are concerned about your scar, again, this picture of the lady, her scar is very tight to her chest, and you can see the lymphedema around the scar. As soon as we released that scar, all of her lymphedema went away. So check your scar. I know a lot of people are not really comfortable with that, but if the scar seems to be the problem, that could be the quick fix, and maybe you don't even need all of the treatment for lymphedema, you just need your scar looked at. And then the other part is here again, oh, this is my lady that's the airline attendant. She has, she had some cording, and once we fixed that up, she was well on her way to getting back in the airplane and getting back to life. So again, just in conclusions, you may see on the internet that there is talk of medications and surgical transplants of the lymphatic system, but here in Canada, we're not there yet. I have seen some of this and people have gone to Germany, but really our best practice here for lymphedema is skincare, massage, bandaging, and exercise. And we know that if people can get their lymphedema taken care of, it will reduce hospitalizations and cellulitis, and hopefully keep you happier and healthier and have a better quality of life.